Okay, go ahead.
All right, what is a vertically integrated healthcare network? So first we start with what is a multi-hospital system? A multi-hospital system is any combination of two or more acute care facilities under one ownership entity. They can be either for-profit or not-for-profit. They have their own provider organizations, such as hospitals, clinics, and physician group practices. And some also manage provider organizations under contract for other entities. Two examples of a multi-hospital system. The first one is Dignity Health, formerly known as Catholic Charities West. They were founded in 1986, and they have some pretty amazing goals to meet each patient's physical, mental, and spiritual needs. And they talk about doing that for their employees as well. It's a very large system made up of more than 60,000 caregivers and staff who deliver care to diverse communities in 21 states. Their headquarters are in San Francisco, and they are the fifth largest health system in the nation and the largest hospital provider in California. The second one is Mountain Star Healthcare. They have 9 hospitals in the system, all of which are in Utah. They are now a division of HCA, the nation's leading provider of healthcare services in 20 states across the country and in England. HCA is a system that we learned a lot about in our class, Hospital Corporation of America, Columbia. They have 50 physician clinics, 9 freestanding surgery centers, and 3 satellite imaging centers. A vertically integrated healthcare network is a health delivery system which groups together organizations that provide different levels of care under one management umbrella. So they have physicians and facilities like the hospital systems, but they also have insurance. This type of integration can include acquisitions and alliances with the following: physicians, health plans or health maintenance organizations, academic medical centers, long-term care facilities, and home care facilities. They are intended to address the following goals: manage global capitation, and global capitation is where you take a fixed fee for providing care for the patient. So for surgery as an example. They form large patient and provider pools to diversify risk. They reduce the cost of payer contracting. They offer a seamless continuum of care, which is really important to a lot of people. It's basically where you transition from one level of care to another without problems or issues. And that's really important to a lot of patients. They respond to state legislation also. Two examples of vertically integrated healthcare networks. The first one is Intermountain Healthcare, IHC, out of Salt Lake City, Utah. They were formed in 1965 from hospitals that were previously owned by the church. It is a nonprofit healthcare system ranked highly in the US. They have close geographic proximity among all of their facilities. It has an adult and pediatric tertiary care facility, and is also affiliated with the U of U Medical School, which is really helpful for doing a lot of research-based work. It has contractual and/or employment relationships with physicians. They operate Select Health, a captive health insurance provider. And these components qualify IHC as an integrated healthcare network because they have provider organizations, physicians, and health insurance. IHC was also among the first multi-hospital systems to form a group purchasing organization. The second example is Kaiser Permanente, states including Washington, D.C., million members, 14,000 doctors, and 160,000 employees. The system owns and operates more than 420 freestanding ambulatory care facilities and 30 medical centers. The medical centers offer one-stop shopping for most services, including hospital, outpatient, pharmacy, radiology, laboratory, surgery, and other procedures, and health education centers. Again, really important to a lot of people to be able to get a lot of things in the same place or from the same organization. Kaiser Permanente's setup encourages patient compliance and enhances opportunities for physicians at the primary care level to communicate and consult with specialists, hospital personnel, pharmacists, etc. There's really only a couple of differences between multi-hospital systems and vertically integrated healthcare networks. All integrated healthcare networks are multi-hospital systems, but not all multi-hospital systems are integrated healthcare networks because they do not operate their own health insurance companies. So as such, the vertically integrated healthcare networks are typically much larger because they have to be fairly big to be able to have their own insurance. In some areas, multi-hospital systems are not allowed to employ physicians directly. They have to have some subcontractors. In fact, where I live in California, that's the case. No multi-hospital systems are allowed to employ their own physicians directly. That's it.
Awesome. Great work.
Thank you.
Yeah, not a problem. You did a good job covering that. Um, a lot of people get confused about a vertically integrated health network and what a multi hospital system is. So I'm glad you put that part in there where every vertically integrated network is a multi hospital system, but not every multi hospital system is a vertically integrated network. So that was really great. So I just have one question for you before you're done, and that's what was the most interesting thing that you learned as you were studying this topic?
Um, Boy, that is an interesting question. I don't know. It's funny because I thought going into this class I would be so bored and I wouldn't learn anything and I didn't need to know this stuff because it's not the direction I want to go in ultimately. But every week I'm like blown away by how much there is to learn. So it's hard to pick one thing. I think that, boy, I think learning about the real organizations out there that are doing this is really helpful. It's not just, it's kind of like in math when you learn a theory and then you can actually apply it and you realize, oh, this really does mean something in real life. So I think learning about like IHC, for example, how in depth it went into for that in the reading, that was really helpful, especially because we used to live in Utah. So we have a lot of ties with the hospitals there, which is partly why I picked Mountain Star as well, because that's where I had all of my kids there, was at a Mountain Star hospital, and we had some really great experiences with them. So being able to kind of tie in what I'm learning about how everything is run and the organization and the structure of it all to the things I've experienced and the things I know about or can learn about if I just want to search it up. Like I didn't know much about Kaiser Permanente, but talked a lot to my husband about it because he runs a health insurance pool.
Okay.
And so he's very well versed, I guess, in how all of this works. So it's been really interesting to not only learn about it myself, but to be able to really get a better grasp on his world, and what he does. So this week has been really nice in being able to do that and learning more about the real things that are really going on out there, but also to be able to kind of bridge the gap a little bit between what I'm understanding and what he's doing for real. So that's been really helpful.
Awesome. That's great. I was going to give you a really good grade, but you said you went to Mountain Star, so no, I'm just kidding. I work in Mountain Healthcare, so
Oh,
no, it's totally
are
totally.
you? Well, everybody's experience is different. Now, I'm not even gonna go into what it was like to have a baby in California because that's where my fifth was born a couple of years ago out here, and
Yeah.
that was completely different experience than having one in Utah. So we won't go there because I want to stay positive. but we do have Stanford here, and it was thank goodness because she was born with some problems and needed surgeries and stuff. So
Gotcha.
but yeah, there's a lot of this is very helpful. Really, I feel so bad for my attitude in the beginning because I really just didn't think I'd learn very much and didn't think I would need it. But I can totally see how no matter what you're going into, no matter what area of health, you have to know this stuff. You have to know how it all works and how it's all run. And so it's really kind of blowing my mind how much I'm getting out of it. So I really appreciate it. Thank you.
Yeah, good. I'm glad that it's applicable and interesting to you. So, awesome.
Yeah.
I'm gonna go ahead and stop recording.